I'm not really sure what occupational therapy is, but when I think about occupational therapy, what comes to mind is that they help individuals who may have lost ability to know how to do certain things in their life, know how to make certain movements.
Yeah.
So I think they help them rehabilitate.
Somebody, I mean, I don't know the exact definition, but when somebody like has a stroke or something, you have to teach them like their everyday lives, whether it's going, well, it's like something as simple brushing your teeth or even driving.
I'm assuming occupational therapy is when people are learning, relearning moves for their jobs, but
I think it's got something to do with the recovery of a person after they have had some type of surgery or something to get back to work.
To become more independent and productive, try to teach him to maybe lift his spoon, help to create some kind of independence for him. So they have also assisted me in helping how to facilitate turning him, movement in the bed.
Occupational therapy is making sure that someone is able to do everyday things like walk and, you know, work in the kitchen, do stuff at their job, you know, everyday things that they would normally do or take for granted, but as a result of, like, I don't know, accident or stroke or something like that, they might not be able to.
To me, there's a lot of different types of occupational therapists. I know of two. A lot of them work in schools and in hospitals. I just know in hospitals, a lot of them would work on like floors where you do shoulder replacements, knee replacements, different bone replacements to teach people how to reuse their bones. In schools, I'm not positive what they do, and that's really all I know.
Occupational therapists' job is to make sure that the patients get back to their most functional activities of daily living in regard to those that might have hip replacement, knee replacement, strokes, making sure they know how to bathe and dress themselves and get into the kitchen and get out.
Occupational therapy helps to relearn different things that you already are supposed to know, but like have lost due to surgeries or issues or something like that.
Therapy is physical therapy dealing with the upper body.
I have a general idea of what occupational therapy is. It's kind of like physical therapy, but instead of working on a broader thing, it's more fine motor functions, like being able to brush your teeth, put on clothes, pour yourself a drink. That's more or less what occupational therapy is, at least from my understanding.
That's a good question because I don't know.
Take a guess. An occupational therapist.
I don't know if it has to do with physical, something therapy.
It does.
Okay.
It has helping people like a physical therapist.
I'm not exactly sure.
I really don't. I think I have an idea, but I don't want to say. Occupational therapy, I want to say, has to deal with the people who take the blood pressures.
Okay.
Your blood pressure, weight, basically all of the vital signs before a doctor.
Occupational therapist is someone who helps people with injuries or recovering from a surgical procedure, get back to a place where they can be employable.
Occupational therapy is therapy for doing everyday activities such as brushing your teeth.
To help, to rehabilitate people due to injuries, illnesses, and psychosocial.
Occupational therapy would be, honestly, I really don't know.
Take a guess.
Okay.
You know what a physical therapist does?
Yes.
Okay. It's kind of
like people come in maybe out of the hospital and get therapy, like after surgeries or something.
But what would an occupational therapist do for them?
I really don't know. I have no idea.
Therapy to help me get back to my profession. And that's it.